2021 board meeting. And a special welcome to Dawn, who's going to Dawn Baxendale, who's chair actually of the West Berkshire Parent Carer Forum, and is going to give us her presentation. We're very lucky that she's actually been able to make it right on time. We were expecting her to be a little late, but due to personal circumstances which have been changed, and that's very good. So we'll say go ahead, Dawn, and then I'll do the introductions to the board later. Okay, over to you.
Well, thank you for having me. As suggested, I'm chair of the local Parent Carer Forum. I've been in that role since a year last October. So we kind of took a view to taking things slowly, and we're now gathering a pace. Bit about me, I'm a mum to 4 children and 1 husband. The 4 children all have various additional learning needs across diagnostics of autistic spectrum, ADHD, Asperger's, sensory processing, anxiety, OCD. So I have quite a mix here. Generally, the Parent Carer Forum is run by parents, and we all have sort of lived personal experience, which kind of sets our tone and our theme. Even our 1 paid staff, Fiona, who's our coordinator, is the parent of an additional needs child. So as I say, we are parents, for parents, run by parents, and we all have a connection in some way or another to a disability or an additional learning need. We take people with or without diagnosis. We're a needs-led operation, so you can come to us even if you don't have any diagnostics in place, but you're having difficulties. So that for children in school could be something simply as they're struggling and parents are not quite sure why, so we can signpost them towards talking with the Senkos and various things like that. I'll get onto that in a little bit later in a little bit more detail, but essentially we invite parents to join the forum, to have more of a say, more of an influence. They can join the steering group and start doing things such as going to strategic level meetings if they want to play a more active role. And the fact is, our commonality is that we all have these children with additional needs. Now, whilst we are at the moment a small forum, our steering group is 11 people. We are linked with the NNPCF, which is the National Network of Parent Carer Forums, and we cover the 192 areas across the county, across the country. And I know there's a disparity there with the number of local authorities across the country, and that's because some of the larger authorities, especially up in Manchester area and that way, some of the London boroughs, they split down, so there's more than 1 forum for an area. Across this locality, across the country, we're split into local clusters, and we belong to the SE19, and in our little cluster there's 19 parent carer forums. So we are the furthest one, the West Berkshire, and we go right through to Kent, and we go up to Oxfordshire, which in one sense is quite nice because then that covers that whole new Bob conglomerate that's coming. So we're kind of working together on that front as well. We work by feeding information into that national level, and we, as well as the NNPCF, are directly funded by the DFE to work with them on government education and health matters. We work with the local authority, we work with the health authority, we work with voluntary sector partners, and the service we essentially offer is to partners like that, is to offer parental views to help them make policies and local offers which are in line with the law, but are also in line with that need of the parents and children and the young people with disabilities in our particular area. You know, we don't tell them how to set policy, but we offer that important lived experience, which sometimes had been missing in the past, and they've actually realised how vital actually having that lived experience is to shape future services that can be offered. We like to work in terms of a co-production model, and I do apologise, Michelle, I know I sent you some slides. It doesn't really matter, but those slides are available that Michelle has that we can send out, and it's a basic set of slides, but it kind of gives you some idea, and I can always, if you need to, write some notes around that for you. Brilliant, thank you. I'm on third one, participate and collaborate, Michelle. Thank you. Sorry, I forgot to mention. You know, as it says, we like to participate and collaborate. We work in a co-production model, and we work from the outset. That's how we should work in co-production, from the outset of the project, where we have input from the very start, where we're all standing in that puddle together, trying to work out what's the best way to start jumping. It would be nice when there is an invitation to work and participate on projects and work streams and be in meetings where there is value of having us there right from the very, very beginning. And like you say, the important part of it all is to offer that lived experience from our membership. You're right, Michelle. Brilliant. So in times of normalcy, normal times, no stay-at-home orders and things like that, we run an annual local offer day where we invite a lot of services from health partners, from the local authority, as well as the voluntary sector, and we hire a large venue. You bring your wares, and we invite members of the local community who have children with additional needs to come and have a look around, chat to people, no obligation. You know, we offer them the opportunity to sign into the forum if they want to. And, you know, we also have the opportunity for them to pick up leaflets. We are, I'm not sure if you can see that at the moment, we are offering out sunflower lanyards with, and I don't have one on me at the moment, but with the small hidden disabilities card, which has become so very, very useful over these recent times. And as I say, we do this in conjunction with the local authorities, local offer team. And as part of that event, we try and invite keynote speakers to offer information. For example, one year we've had Carly Jones, we've had who spoke on autism, we've had Stuart Balustrade from Irwin Mitchell to talk about wills and guardianships and trusts. So those are the kind of things that go on, and we offer other live Q&A throughout the day. And as well as that, on a month-on-month basis, we try and put on at least one workshop for parents. So that could be things from Sunday Ask, where we talk at specific things about the EHC process, about transitions is one of the things we'll be coming on to look a lot at this year. We offer workshops from Cerebra. We kind of pull in things that parents are telling us that they're struggling with. So that's how we work with parents. Our remit is with the parents, not directly with the children. We work for the benefit of the parents to help the children. And we pull in services to help us do that. Our sole aim is to offer the lived experience to feed back and improve the services offered to families throughout our district. And again, we do that by empowering them with the knowledge that they may be able to speak out and speak up about their own needs. One of the ways we can gather information and the views of local families is we offer out a monthly newsletter, and we share information around what the local authority put out, the projects we're working on, and any special offers that are going on. And we look at across the board, from local authority, education settings, health providers and other voluntary providers. And it's basically to highlight where local services and processes and commissioners may not be working so well. So, you know, they get brought up through these surveys and through contacts, emails, and then we try and sort of survey quite a wider population to see if there's a common theme brewing. So that's kind of how we feed in. And I appreciate, you know, we do an awful lot, but I'm rattling through things. One of the direct ways we reach parents is to have coffee mornings in schools, or we have a send chat. And again, that's where we bring together people in schools, and we may sort of do the coffee morning, which is slightly more informal, or the send chat, where it's kind of a similar but different how we piece it together in terms of whether it's being run by the parents or being run by the school. So one is more school based, and we kind of help them make their coffee morning through the send chat, and then we can start helping feed that. So for example, Brookfields, through some training yesterday, highlighted the fact that they're struggling with transition. So obviously our next coffee morning, or the one after, we will try and put together a package about transition for them, so that they feel empowered, they have some idea. So I'm working on checklists and a little pack to put together for that. So it's all quite busy. And each of these 192 forums all work individually in our own way to meet the needs of our own local communities, working with, because we all have different local availability of voluntary sector services. But collectively, we all really do the same thing. So together, when we come to annual conference, we bring all this cacophony together, and often you can see key themes that spread across the whole country. One which we all struggle with being CAMS. So again, rather than being critical, and although we're critical friends, we like to come more with a solution rather than just the criticism. So you know, as quite a large, I think you're looking at around 182,000 members through the NMPCF. We're beginning to have quite a loud voice, and have done some nice partnership work over the COVID months with the Department of Education, trying to help children settle back better to school. Now, Michelle, on the final slide, it may or may not look blank to you. There is a small video. Now that runs for 3 minutes. I don't know if there is time for that video, but we are a hosted forum, and this is an animation that the host charity who help us put together on our behalf to kind of explain very simply how we come together and we grow and work together, and how we grow as a forum and as a voice. If there's not time to play that, please don't worry, it's there and it's part of the presentation, so it should go with it if it's sent out. But you know, as far as I'm concerned, I've waffled on for long enough. You know, I'm happy to take questions if that's appropriate, if there's time.
Let's play the video if we can.
Some sound, Michelle. Doesn't matter without the sound. It still gives the same message.
Is it playing?
Oh,
It is playing, just not with sound, oddly.
Oh.
It doesn't matter, the message is still there.
It is a bit faint.
It's lovely music, by the way. Nobody can hear it.
Oh, that's a shame.
I can.
the idea behind it, seeing as there's no sound, I'll talk a narrative, you know, is it shows that people can come one by one, and we're here. You stood at the door, you kind of feel overwhelmed. Actually, as you can see, and you start looking around you, you're not alone. There is always more than one person. And we can end up sitting around the table with a variety of people, from counsellors to children. They have as much a valued voice in this lived experience as the adults who look after them. And we share the experience, we share the solution, and we work together. And it doesn't have to be such an overwhelming place to be alone, and you'll always be welcomed. And that we have collective strength, we have a collective voice.
Wow.
And with that collective strength and collective voice, our voice can be heard. I think when you're having a difficult time with a child in crisis, or has a problem you don't understand, or is showing behaviours that you can't comprehend, just knowing that there's somebody else that you can talk to, or can point you in the right direction, or a direction you've not been in, it starts to bring the comfort that you aren't actually alone. So that's where we kind of facilitate bringing people together to help that.
Thank you, Dawn.
No problem.
Most interesting. Could I just ask, is there a sort of minimum and maximum age range for
Our
your
remit is from
children?
birth to 25.
Birth to 25. Okay, thank you very much. And would any of the other board members have a question? Martha?
Yeah, so thanks for that, Dawn.
You're welcome.
Yeah, so it sounds as though you have quite a good sort of working relationship with the local authority. So you
We
sound
do.
from your comments. You funded through central government, are you? That was the question. And
Yes.
also, do you have? It sounds as though obviously the carers, you're supporting the carers, and do you find that what facilities do you have to support your carers, you know, to care for the children? Do you know what I mean? Yeah.
We literally have a shoestring. We have no facilities per se. We have nothing of our own, short of a laptop or two, and a couple of phones. We have a grant directly from government, which is administered through an organisation who distribute the grant to the 192 forums. And yeah, the way we support the parents is up until the last year of the pandemic, we would hire facilities, and we would bring in the speakers and run the workshops, many of which are at low cost or free. Some we have to pay for, and they will often put together resources for us. Or we try, you know, this whole year of living through a pandemic has given us all new insights as to what the electronic world can achieve. So actually we're putting more and more things online. This morning we've just uploaded ready for the children going back to school after Easter. It's actually two of my children have put up, one of the older ones, one of the younger ones, how to do the lateral flow tests and not to be scared of them. So you know, that's available for those, for any parent. It's on the website, it's on the YouTube channel. So we're kind of trying to make use of as many free resources as we can, because we don't have a lot.
Great, thank you very much. And Andrew, you have a question?
Yeah, hi, Dawn. That was fabulous stuff.
I'm looking for you. Where are you?
Waving
Wait,
over
thank
here.
you, sorry.
Yeah. I get the relationship with local authority, Department of Education, etc., is really kind of well set. What's your relationship like on the health side? So both with people like the clinical commissioning groups and also your local GPs. I'm interested to find out how responsive you find them, because one of the reasons I'm asking is obviously one of Healthwatch's remits is to take patient feedback back to the Health and Wellbeing Board, back to the CCG program boards, so things like mental health and learning disability boards. So I just wonder whether or not you've already got very good connections in there, or whether we could potentially offer a partnership or some help.
Yeah, I will always take any help like that. I think one of the biggest areas our families are struggling with is CAMS. I think as is most of the world. Personally, I'm suffering badly at the hands of CAMS. We sit, I go on a regular basis to the joint integrated group it was run by Sally Murray, who stepped down at the last JIG meeting. So we're waiting for somebody to open their arms and take over. Nobody's rushing for that position at the moment, which is quite sad, because it is very useful, because it covers quite a wide range of topics. And again, we work closely with Reading Family Forum and with Wokingham Send Voices. We all sit on there. So again, across the CCG, I've been in post, as I say, for just over a year, and I've kind of sat and watched how the land lay for a while, but now we've kind of got more work than we can realistically juggle at the moment with projects we want to do. So we're always looking for things, and health is one of the problem areas that we're finding. I sent quite a few irate emails across to our administrator overnight going, ruh, ruh, we're not, they're missing us out on this. So, anything in terms of health, really the joint integrated group is where the only real place where we have anything. We're not working with the GPs yet, which I think we should be locally. My GP has been absolutely phenomenal, and I know he's very much for parent working. So again, it's kind of learning to put ourselves out there and make these introductions. And the more, I think at the moment, because we're a small group, the more we put ourselves out there, the more people will come. It's that old, if you build it, they will come. And then, from there, our world can grow more in terms of support. So yes, we have a good insight into that. And from there, we're just starting to kind of pull at threads. So we're now becoming involved with the dynamic support register and feeding into that. But beyond that, health is still quite elusive, and social care's a non-existent pathway to us at the moment, which again, in terms of joining up this thinking that's supposed to be joint and integrated, isn't working at all to support our parents.
Right, thank you very much. Thank you again, Dawn, so much.
That's okay.
Leslie's got a hand up, Mike.
Oh, is she?
Hi, Leslie.
Hi, Dawn. I just wondered if you wouldn't mind saying a little bit more about the Carer Forum's relationship with CAMS. How do you work with CAMS?
We don't at the moment, is simply put. I'm trying to, based on our own personal experience of the last 7-8 months, I've tried to reach out in terms of being chair of the forum, and it hasn't gone particularly well. In terms of next steps, I've reached out, and forgive me, I can't remember his surname, but I've reached out to Daryl, who I understand is the participation manager. So I'm waiting for him to respond, and I've got an email to write to, and bear with me, it's in my little diary note. I have to say I would be lost without my electronic diary notes. I have an email to write to either Joe Coxley or to Marie Duffield, to kind of make that formal introduction, but as yet nothing is ongoing. But we have a lot of parents coming with questions. And one of the projects we're working on at the moment is based around the emotionally based school avoidance scenarios, but we're actually taking a slightly deeper look than just the school avoidance, but looking at the mental health care around, and the interim provision, school provision that goes in around that. We seem to have found a bit of a sort of dead end hamster wheel with our research. So we just want to explore it a little bit more and have something definitive to reach out to Karen.
Okay, thank you.
Unfortunately, we can't make them do anything. We can only put a fait accompli in front of them and say, you know, this is what our parents are experiencing.
Sure.
What can we do?
Thank you.
Okay, thank you
We'd
very much.
like to do more with CAMS because it is a real big sticking point.
Yeah.
Andrew?
Yeah, Dawn, I think we should have a conversation offline about this. We've just put together a CAMS report, having had 130 people fill the survey in, and we have got some connections. No, but we've got some connections within
Fabulous.
BHFT, and I think if we work together on this, we may be able to get a little bit further. Mike, I just wondered whether we possibly might want to amend our agenda a little bit, because we've got the one question from Lorraine that was obviously addressed to Healthwatch, but also was asking sort of Dawn as well. And I wondered whether we should potentially take that first rather than at the end, because then Lorraine and Dawn don't have to sit through our very exciting board meeting if they don't want to. I wondered what you thought.
Yes,
Yeah.
by all means. So, so Lorraine, perhaps you'd like to introduce yourself and
yes, hello.
Question.
Yes, hello. I've been a psychotherapist for about 25 years, doing a lot of work in school, in fact, Dawn. In the last, I suppose, the last 8-10 years, I've been more and more drawn to thinking about parents with their first baby, particularly, and how important the emotional support, emotional and psychological support is for those parents. There are so many who I think we're all aware of now who find it a real struggle, especially with families not near each other as they used to be, and of course with COVID. I attended a very good course, particularly last year, just before COVID, at Anna Freud Centre. And it was about working with parents and babies. And I've done a lot of work with families over the years. So Dawn, yes, I'm very interested to hear about your work and what a lot of work you've got. My goodness, what a lot of energy you've put into it, and you are putting into it. Congratulations.
I just wish there was more of me to go around.
Yeah. I suppose Andrew and everyone, Martha, I know, hi. It would be, I'm really putting out feelers myself, because I'm aware that there's a real need there for mental health support. And you're talking about CAMS. Of course, there are many other professional mental health professionals who work locally. And I just want to make contact, really. I think your suggestion is a very interesting one, Andrew. And certainly I did address it to Dawn. So again, I think it would be very useful to think about, maybe I could give a talk of, we could discuss this offline perhaps, Dawn.
Yeah.
I guess, I mean, you talked about, someone asked about, the age range of the children. And of course, with the children you're working with, those needs continue for a long, long time. And certainly I've worked with many parents in your position, in fact, and quite a lot of children as well over the years.
Yeah, and I think what's scary as well is situations like ours where we've gone, unneeding of anything beyond universal service, and all of a sudden we just come up to 17.5 and boom, we suddenly need everything thrown at us in a very short space of time, and they can't cope with that either, because they just don't know what to do, because it's that whole grey area of 16 to 18 is a big problem, because they have mental capacity, but they may not know what the best journey for them is. And, you know, like you say, at both ends of the spectrum, there are things to be worked with, most certainly.
I suppose my focus is very much on working with the first 1001 days, and the report came out last week. I'm not sure if it's actually published yet. I know it was a cross-party, parliamentary cross-party political report that's been drawn up. I do know that Andrea Ledson is leading it, and that there was a kind of launch of it last week, which unfortunately I couldn't attend on Zoom. But I'm aware of the focus very much on those first 1001 days of a baby's life, and how incredibly important that is, and how much support there can be given from all the different departments, of course.
And that leads me to think of one lady immediately who works with Dingley's Promise, and they see those young early years people.
Yeah. So I'd like to make contact with you afterwards then, Dawn. And to anyone else who's interested.
Michelle has my contact details.
Okay, thank you.
Specifically, Lorraine, you asked the question, how will West Berks Healthwatch address the cross-parliamentary launch last week, Start for Life? Well, of course, we're now in the pre-election period, so we can't really comment on it. However, given the work we've done with our maternity report, our work with the West Berks Maternity Forum, we certainly welcome any and all initiatives, and we'll obviously wait to see what happens in the future as the action proceeds.
Yes, I actually watched and was on Zoom for your meeting, which was on the maternity forum, and wrote something in the Newbury afterwards. And Martha, I referred to you with such knowledge of health visitors and so on. Yeah, and it's an excellent. There's a lot of excellent work being done, isn't there? Yeah.
Right. Well, thank you. I hope you're.
Thank you.
Satisfied.
Adrian's got a comment, Mike.
I can't see on my screen. Sorry.
Adrian.
Yes.
You can say that if you're not aware, there is a health and wellbeing strategy being drafted at the moment, which covers West Berkshire, Reading and Wokingham over the next 10 years. And it's working on 4 or 5 priorities, one of which is early years, so first 1001 days. Yeah. Another one is mental health. It will be very high level, but and it's being drafted fairly quickly at the moment, and then there will be a consultation on that. I suppose the opportunity there is to get something on the agenda. You know, I don't think they're not going to be taking lots of detail at this point about how to tackle problems. That will come along later. But by getting a line in there about particular issues or particular ways of dealing with the problems, it might be possible to get things on the agenda and so have an impact over a number of years. So just
thank you for that. Yes, I'd like to be in touch with you, Adrian. I'm sorry, I don't know everyone's name, and it's not very easy to read it on the screen sometimes.
All our names are on the website,
yes.
Lorraine, if you need
yes.
them. And you've got obviously our contact email address, which is, I think, the best way to follow up, because we've done a lot of work in this sector and we'll continue to do so. We also sit on the Health and Wellbeing Board, which is a very useful forum for us, so we can equally, and one of their priorities last year was in fact the first 1001 days, and there is it would seem some appetite to try and get this right. Trauma-informed care is being talked about, and adverse childhood experiences a lot. So this is obviously something that people see as important, but I think one of the points that's been made by both yourself and Dawn is that integration just isn't really happening in the way that I think people think it should. So I think that's one of the things we've probably got to keep pushing on. And I think all feedback we get, whether from parents, carers, children, experts, etc., is really welcome, and we're always happy to look at additional volunteers who may be able to help with specialist knowledge. So if we can connect offline, I think that would be excellent. But thank you, Lorraine, for the question.
Thank you very
Mike,
much.
back to you.
Thank you very much. We have obviously jumped around a bit, and it's almost a little late to welcome everybody and introduce ourselves, but we will do that immediately. So welcome once again to this fourth, I think it is, Zoom board meeting. I didn't quite expect back in March last year when we met in public that we would be not meeting again in public till at least June, if not later, the following year. But anyway, so welcome. And if I'd just like the board to introduce themselves. I always find it exceedingly difficult on Zoom because pictures dance all over the screen, but I'm Mike Faraday, the chair. Andrew, perhaps you just introduce yourself.
Yeah, sure. I'm Andrew Shott, Chief Officer of Healthwatch West Park.
Judy?
I'm Judy McCulloch, one of the board members.
Leslie?
Hi, Leslie Wyman, also one of the board members.
And Martha?
Hello, I'm Martha Vickers and I'm a board member.
Adrian?
Adrian Barker, board member, also chair of the patient panel, which is the GP patients group.
And Karen?
I'm Karen Swaffield. I'm on the on this group.
And Michelle?
I'm sorry, I'm still chuckling about Karen being in this group. It was like you were lost, Karen, for a second.
Yeah, I was. It's miles away.
I'm Michelle. I work for Healthwatch West Berkshire as a bit of everything, really. Admin, digital information officer, kind of a bit of everything, really.
And Alice?
Hi, good afternoon, everyone. I'm Alice Clifton. I'm the engagement lead and the development officer for Healthwatch.
And Nathan?
Hello, everyone. I'm Nathan Pope, digital and social media officer for Healthwatch West Berkshire.
Thank you very much. And have
No, Paul.
Paul.
Oh, sorry, Paul.
I'm Paul Wilson, and I'm a board member.
We don't have Amanda yet, do we? No. Okay, right. Thank you very much. Now we have, I suppose, I was going to say a half apology for absence. That's not quite true. Amanda Cunnington is maybe, well, I think maybe late or may not be able to arrive at all due to complications with her work. So we might see that. Apart from, there are no other apologies for absence. Are there any declarations of interest that have not been declared before? No? In which case we'll move on to the minutes of the last meeting held in December. They have been circulated. So does anyone have any omissions, errors in those minutes?
Mike, I think we may have missed a couple of the actions off the action log moving from the minutes to the action log, but perhaps we can check after the meeting.
Okay, right. Well, we can see that. I haven't got the action log before me, apart from the actions actually in the minutes there. But is everybody happy with the minutes? I don't see any negative comments, so we'll move on to matters arising. Are there any matters arising that are going to be covered in the agenda? No? Right, the action log. I haven't got it on my screen, but do
you want me to help, Mike? Because I've got it in front of me.
That.
Yeah, item 6 relates to the Great Western Hospital enter and view visit, which we talk about later in the agenda. And this was both off, then on, then off again because of lockdown. So it is, as it says, ongoing. Item 8 is the quality framework, which again, I think we'll cover off later on.
Yeah.
But is equally ongoing. Oh, I've got 2 item 8s. Oh, okay, fair enough. The next action point was relating to John's campaign and our COVID survey report, which has just been published in draft, but hasn't actually been formally published, and sending it through to John's campaign, who interestingly tweeted today that infection rates have dropped 62% in care homes since the vaccination of the first vaccine, which is very, very good news. We will be sending that through, but that's an ongoing one in the action log. And item 1, the visit to Pete Campbell, I'm afraid still hasn't been arranged, but I will be chasing that up. And the final one about the accessible work plan, which again will follow on from the item in the agenda. So all the actions are still, sadly, outstanding. And I think we've got a couple to pick up from the last set of minutes. Back to you, Mike.
Okay, right. Thank you very much. We will then move on rapidly to, because we're running somewhat behind, to item 4. Andrew, the Chief Officer's report.
Yeah, hopefully we can make some time up, because I think an awful lot of the things I want to cover are covered in the agenda, so I won't cover them twice. Obviously, our COVID report, which Karen brilliantly helped us put together, has finally at least gone to in draft form for our health and wellbeing partners to have a look at. And again, we'll discuss that later. Same with our CAM survey and report. Dental remains a live issue, and again we have got a survey running currently, which we are hoping everyone will fill in on their experience of dental services during the COVID pandemic. We're working obviously towards a combined response on the NHS White Paper, Mental Health Reform Act, and CQC regulation reform, and we have obviously put in a joint response there from our Bucks, Oxford, Berkshire West joint post, Catherine Williams. Again, I think we'll pick that probably up. And I think the other thing which we've been really pleased to be involved in is both the vaccination board, which has been meeting weekly, so that we've been able to actually feed back. And this is where we mentioned this in the COVID report, the importance of providers, commissioners, not just providing broadcast information, but also taking it in and through is, and certainly at the vaccination board, we were able to provide some really good intel for gaps and equally actually assisting them getting vaccinations out to communities that sometimes don't respond as quickly or as well for a variety of reasons. And also there's been an equalities board started to try and help mitigate some of the issues around vaccine take-up. And then, as Adrian's already mentioned, one of the really key pieces of work we've been involved with the last 3 months is the joint health and wellbeing strategy. And one of the things we're working really hard on at the moment, actually trying to make sure it ties up with all the various strategies and program boards run by both our integrated care system and our integrated care partnership locally, rather than everyone going off and doing their own thing. I'm still quite concerned that there isn't enough high-level support of this as a project and a document, but we will be bringing this back to health and wellbeing and our various meetings with the ICP and the ICS. And then the other thing I just briefly want to do is obviously thank all our amazing volunteers who've still managed to do stuff during the pandemic remarkably, although we have mostly been doing it virtually. And also a huge thank you to the board for the amazing work they've equally been doing, and to all the public who filled in our surveys we have to keep telling everyone it really matters, and it doesn't always have to be, you know, only a really serious complaint. It can be a niggle, and also the compliments. There's an awful lot of compliments we received in our COVID report, and they've all gone in, so they will all be being seen by various people. So hopefully, Mike, that's all I wanted to cover, because I think we'll cover nearly everything else off, but we're still all here and mostly in one piece.
Great, thank you. Thank you very much, Andrew. Then we'll move on to item 5, the COVID-19 care home visits, which Alice has been involved in. Alice, would you just like to update us concisely?
Well, since the last visit, I haven't been out, but I'm hoping to have, once I have my vaccine and once we have the clearance that we can visit the care homes, that's the plan to going forward. That will still take place.
How many do we intend to do in total?
At the moment, we are looking at 12 altogether.
That's a large number. It's a lot of work. Well done, Alice. You've really been clad in your full PPE. Done a fantastic job, I think.
Well,
which week have you blocked us off our calendar, Alice?
That's not the care home one.
That's the next item. That's the next item.
I might as well say.
So in fact, if you finish with that, Alice, please move on to the next item, and you'll be able to put Karen's question right.
So just to update you all, this February, we were meant to be doing a virtual visit to Great Western Hospital. And because of the COVID, the numbers of cases we've had to postpone it. So now we are planning to go in July now. That's where the calendar, your calendar has been blocked, July the 5th onwards for a week. And hopefully it'll be still virtual. However, things might change. So watch the space. And this is the work that we are doing jointly with Healthwatch, Berkshire and Swindon. And also the Great Western Hospital is also supporting the project.
Could you just say what the virtual visit is likely to entail?
At the moment, what the plan is, the hospital has got some volunteers. They've got an iPad. They will go and see the patient. So the plan is to look at the A&E and also some of the medical wards. I think one medical ward and one surgical ward. And the volunteers will go and identify the patients, and then we will ask the questions virtually to the patient.
Okay.
So that's the plan.
Well, it'll be very interesting to see how that happens if it doesn't.
I mean,
like that.
Yeah, I mean they've got all the iPads and everything ready. So so it's up to us now to do it.
And you think we can cope at our end?
I mean, because it's 3 health watches together, so I think yes, we can.
Okay, thank you very much. And you blocked off everybody's diary, have you?
Yes. So that nobody can say they didn't know about it.
Oh, quite. Okay, thank you, Alice. Right, let's move on to the item 7, the coronavirus recovery COVID-19 survey and report. Andrew, would you like to start off?
Yeah, so very like our recent maternity report and previous reports like Voice of Disability, we ran an initial survey jointly with Healthwatch Reading, Healthwatch Woking, where we all asked 12 identical questions, but then we added another 36 to try and get a more all-round experience. That ran until August. And in the point of putting the report together, we continued to receive feedback on a range of different subjects. So the report in itself covers not only the survey, but also what we found post the first wave, which was kind of really important, and just as we were going into the second lockdown. And from the report, which I think we had just over 300 responses to the survey, and there's probably another 20 or 30 bits of specific feedback helped write the report. We've ended up with, it's in draft form at the moment. It's gone to the Health and Wellbeing Board for an initial look at, and then the aim is it will be published publicly for the May public board meeting of the Health and Wellbeing Board. And they've asked us to write to the respective providers, which is everyone from the local CCG all the way to the Ministry of Housing, Local Communities and Government, Department of Health, NHS England, for responses to specific points. We've added in 13 recommendations based on the survey and the feedback, and they range from relatively local issues about looking after carers to broader issues in terms of the relaunching completely of NHS dental services, bringing together the community and voluntary response from the national NHS volunteers to the local community one, which worked brilliantly. And it's clear how thankful everyone was of the community response. And I suppose the other key one really, which has been noted and everyone has taken notice of, is we've equally asked that frontline staff from both NHS and social care get a breather, because, you know, the sheer pressure they've been under, it was bad enough going through wave one, but the actual deaths in wave two dwarf those in wave one. And they've virtually been working at 100% plus capacity for a year. And we need them not to collapse. We need them not to leave. We need their mental health being looked after and well-being so as they can continue to do the splendid job they've been doing. So there's a range of recommendations. It would be lovely to be able to publish this, but we have agreed with Health and Wellbeing that it will be published firstly at their board meeting in public in May. So I would urge everyone to attend, put in public questions where relevant. So hopefully the report will cover off a lot. We have admitted we probably missed a few things out in doing the survey. It was quite health orientated, not a huge amount of social care, but a little bit. But everyone, when you go through a pandemic, learns, and we certainly did. So I think that's all I want to say on the report. Anyone got any? Oh, and also yet again to thank Karen.
I was just going to jump in and say thank you to Karen for her
amazing job.
Yeah. Any questions on that from the board? How does it compare with the publication dates or whatever from the other health watches?
Well, to be honest, the other local health watches only did the sort of 12 question report, which didn't really cover a huge amount, and there was lots of like yes no answers, whereas we had so much rich content. That was why we ended up with quite so much, and then the feedback that we got. So it seems to be quite an interesting model that, you know, you start with a survey, but then you build around all the other intelligence that we get. So you get a far richer report. And I'm hoping that, you know, the board have obviously seen it all. While we've obviously had a few comments about how challenging some of the national targets might be, you know, it's really interesting to see that some of the thought processes in NHS England are actually mirroring the report in terms of where control of NHS dental goes and things like this. So, you know, I think sometimes it's important to challenge both the local and national systems. And if they're doing it wrong or could do it better nationally, we need to be able to tell them whether we're Healthwatch West Berks or Healthwatch England. So I think that's all I need to say on the COVID report. I'm glad there were no questions. Goodness, you did well there.
Yes, no surveys are easy to do and easy to collate the data, but they don't tell you a lot about what people think and say. Okay, all right, thank you for that. The next item, item 8, which is the quality framework, and also the website update. Well, Andrew and I are still working on the quality framework.
We are. And then the other, I suppose, pertinent bit of information on the website is, and again, it's probably down to the fact we weren't really expecting this second lockdown. We've pushed back the website refresh until December. And that's partly because we either would have had to press the button in January, and then the next cohort from the new Healthwatch England model doesn't happen again till December, because there's a major update of the software that sits behind it all. So I spoke to Mike briefly about this, and we just were in no position with the various reports and surveys that we had on board to take on the complete website redesign, relaunch in Jan, Feb and March. So we will be pushing that to December.
Great, thank you very much.
That's that item done.
And we move, sorry, something's happened to my Zoom. Okay, fine. We move on to the next item, item 9, which is a series of reports we want to talk about. The maternity report, are you leading on that, Andrew?
I'll just quickly say that I have some concerns that, having had a very good reception at the Health and Wellbeing Board back in, I think it was September. Was it September?
Yeah.
We've had various personnel move from the CCG. So Sam Burrows being a major significant loss to the CCG, who hasn't been replaced currently because he was the CEO of Berkshire West Clinical Commissioning Group. And it appears at the moment the ICS are saying they won't be replacing him, and yet they have to put someone in place of significance. So we've lost a little bit of momentum with the maternity report's findings there, which I think we've got to try and pick up again. Alice, I don't know, do you want to pick up on the maternity forum and the EDC work around it?
Yeah, I mean, at the moment we've been asked by Reading Maternity Voices to do some work with them about ethnically diverse communities. And that also, you know, that is from the stuff that we did on the focus group, the health and well-being priorities. So we just a matter of time to come together and discuss more. But it is all about looking at what changes we need to look at for the ethnically diverse community. Because the back, if you look at the back community, they're 5 times more likely to die in childbirth and all those kind of, so they're looking at processes that's taking place. So we are at the moment asking different hospitals what they are doing regarding this, we are involving the ethnically diverse communities.
Okay, thank you, Alice. Thinking together. Is this down to Adrian, Andrew, or to you?
A little bit of it. Leslie's got a hand up. 1 second.
Sorry. So yeah, I put my hand up. I was just wondering if we were going to carry on doing anything around health visiting.
We will.
As a result of the maternity report, because that did come up as an area service that we wanted to look at, and I think it's quite important. But I don't know, does anybody else have any thoughts on that?
Martha
has.
I'd agree.
Right. Well, I mean, it's I think it's heightened the profile of health visiting and the needs, and the discussion at LOEB about the problems, to families about, the result of lack of face-to-face contact. So I think it's made us more aware. So I think we need to be getting a bit more information about health visitors as a resource and their numbers.
Yeah.
And it just tends to get sort of sidelined a little bit, doesn't it? It comes
It
under
does.
maternity services, but it's quite different. It's more in tune with what we were discussing earlier with Lorraine's question and the 1,000.
Absolutely.
Much more linked to that the maternity, and I think it gets a little lost. So we need
Right.
to have health visiting as a focus on the 1001 days and what's happening as a result of all those child development checks that's been missed. You know, again, that feeds in a little bit into Dawn's area. You know, if Dawn has any thoughts about health visitors or anything like that?
You're on mute, Dawn.
She's not unmuted. No. I don't think you're on mute.
You're on mute, Dawn.
There we go. It wouldn't unmute, sorry. Yeah, it's not something that's come across our purview at the moment, but probably because we haven't been looking, in fairness.
Okay, thank you. Anything else on that? Okay, on to Thinking Together 5. Andrew, is this you?
Well, I can start, and effectively just to kind of clarify things, because we've made an amend to the work plan about this. We've been commissioned by the Health and Wellbeing Board to run 2 events for the next 3 years, loosely around mental health and the Thinking Together model. So we held the 5th one last November, which was the first one we've ever done virtually. We were very worried about whether it would work as a forum virtually, but with the breakout rooms, it did seem to. And Adrian is helping manfully with putting a report together that will go to the Mental Health Action Group shortly. So I'll hand over to Adrian.
Yeah, I've written up what was actually said during the event, including the plenaries and the from the notes I've got of the working groups. I wanted to put a bit of context around it, so something about the sort of the national policies that are relevant and what's coming out of national surveys around mental health, and I've got some of that together. But I think the next thing it'd be quite useful to do, well, we need to come up with some recommendations, but also I wondered whether we can go back to the participants and the people who were invited to just to get an update on how things have been in the latest lockdown. I mean, I think it'll be a lot of the same sorts of things, but there was quite a big difference between the first lockdown and the second lockdown, and I imagine there'll be, you know, even more changes from the third. So we can get an update on how they're responding, but also for them to comment on recommendations and make sure we've sort of reflected what they were usually thinking, and you know, we're going in the right direction.
So Adrian, if I can just ask the question here, we've obviously got the email addresses and things. Do you think we need to go as far as sending out a draft report, or should we just do potentially something like a doodle poll with the recommendations and get a view of whether people agree, disagree, agree greatly, or something like that of the recommendations, and then ask if there's anything they think we're missing on the recommendation side? And then I tend to agree, because November was a different world, because we had got used to a relative amount of freedom. We were being told how we were all going to party like it was 1999 at Christmas. And 4 or 5 weeks later, we were back into another lockdown, which we're still in. So I think it was really, it was a really interesting thing that we were taking the temperature of people from the first wave and the follow through. I don't think a single person at the meeting was expecting to go back into a 2/3 month lockdown. So we had quite a lot of optimism. So I think your point is well made in terms of, it feels like this lockdown that we're currently in has taken a much heavier toll. And I don't know whether that's because people's expectations were that we were sort of through the worst of it and then the vaccinations would save everything, but I'm not sure how best we might do that apart from holding another event.
Yeah, I think probably do it by email and keep it fairly simple. You know, anything to add to what was said before, a brief summary of the recommendations and any comments, and then make the longer report available, either as an attachment or contact us if you want it. We'll have to work out the best way of doing it. because I think most people won't want to look at it, but I think it would be nice for people to have the opportunity, if there's anybody who does. You know, we're not trying to keep it, you know, keep it secret or anything.
Judy, did you want to say something?
Yes, please. Can we bear in mind there have been 4 other Thinking Together reports, all with recommendations, and I think that if we keep on making recommendations without reflecting back to the recommendations that have been previously made, or checking that the recommendations have been followed through, then they're really not going anywhere. So I'd like to see something in the report that pulls together all the previous recommendations and reflects on what's actually happened as a result of them. Because I know some recommendations from the report I wrote haven't moved forward. And I'd like to see that you know, there's no point in writing a report, writing recommendations, and then nothing happening. You could be writing the same recommendations as we've written 4 times before. And I think we should actually make sure that we're pulling everything together, not just writing a new report with new recommendations that nobody does anything about. We need to make sure something is happening with the recommendations we've already made.
I think it's a very good point. I think maybe we need to do the exercise first of all, look at the recommendations, what's happened, and then decide the best way to use that, whether it's to be within this report or as a separate standalone item. Because there's a bit of a risk that it weakens the report if we say, well, you've never listened to us before, but we hope you do this time. But on the other hand, if we can say, well, look, you listened to us on this, this, and this, but you know, not on the other things, and here's some more recommendations, and you know, just maybe sort of think about the best way of presenting that.
Yeah. I mean, I agree. You've got to be very careful about the way it's represented. I certainly wouldn't want it put in the body of the report, but I think perhaps in an appendix form and as a cross-reference to recommendations being made this time, where they are the same as previous recommendations, then I think that's quite important.
I think it's a good point you make, Judy. And certainly you don't want to keep on saying the same thing without any evidence as to whether or not anything has happened. I suppose you could almost end up with a mini report looking at all the previous recommendations and just commenting on what has happened. But certainly there's no point in having the same meeting with the same recommendations every 6 months or whatever. And I certainly hope the next, well, from a personal point of view, I would like to think that the next Thinking Together is actually held live in person, because although the virtual one did work, I don't think it was as impressive as had it been in person. So I don't know when we're thinking about having the first one, Andrew, but I assume it's some months away, in which case you may well be back to some sort of...
I think the other really interesting curveball that's been thrown at us is as a challenge, and we've talked about this in various other things about things like CAMS, but the broader mental health and well-being of younger people. So it has been mentioned that we consider holding an event specifically looking at that in some sort of format where we actually get to hear from younger people. So there's another challenge for us, but I think we are looking certainly May, June, and I'm led to believe that lockdown proper currently finishes on June the 21st. But we should potentially be able to do some sort of COVID secure in-person version. And I think that is something we should certainly strive for. Martha, you've got your hand up.
Yeah, well, I would hope if we're looking at young people that we'd be going to Time to Talk to work with us on that.
We are already talking to Time to Talk.
We're already doing that because they're great in their way of their...
And we're talking to Berkshire Youth.
Yeah,
and various other people that Alice has been in touch with. So, but
sure.
it's also some work that's coming both from the local authority, from the CCG.
Yeah.
There is this clear view that things are not as they should be, and our CAMS report, when it's published in 6 weeks' time after the pre-election period, will absolutely undermine that things are not in any kind of place where they should be. Dawn, I think you just wanted to quickly make a point.
Yeah, actually, funnily enough, one of the medical appointments I've had this morning was CAMS, and I picked up their document. You said we did. There's no date on it, and I just laughed actually with some of the things they've got on there, because whenever they did it, nothing's changed.
Okay, thank you. Right, well, I think we need to move on. So on to voice of disability, and I think that's you, Paul. Or maybe Andrew.
I think Paul's on mute. Paul? There we go.
I put myself on mute. My dog decided to bark at the cat right outside my window. So I think we were going to catch up on this, Andrew, sometime during this week.
That's certainly the hope. So for the rest of the board, we have a date in the diary of the Voice of Disability follow-up going to Health and Wellbeing Board in public in September, which I think was done with a view to sort of saying, a bit like Judy was saying, with thinking together what has been done and what hasn't been done. And also, of course, the Voice of Disability original report, had obviously no mention of COVID, which is obviously significant. And I think also Paul's got some other details of some of the work he's thinking we should be looking at. Paul, back to you.
Yeah, I think sort of, as I sort of put out a document for maybe creating some kind of sort of steering group, which I guess from looking at other groups, there's been quite a few groups from West Berkshire, Berkshire. I know of quite a few that have sort of got together and attempted to make changes over the years, and because they've not really had backing, so to speak, they've not really been able to sort of achieve much. And as soon as I read The Voice of Disability, it brought back obviously a lot of issues that we're still having. Again, I think I've mentioned before, sort of 20 years on. So the steering group was really to maybe try and bring together a group of disabled people across West Berkshire, and see if we can get the steering group momentum to tackle some of these issues, maybe even help West Berkshire or the different areas that need help with views from disabled people and how to tackle them. That was the main thinking around the steering group. It could be a forum, it could be a Facebook group to start with, and then I think going from there, and I think it will also help with some of the issues for Voice of Disability, certainly keep them live, if you like. I know it's just been mentioned that sometimes once a report has been produced, it can be given to the areas, but again, we're 20 years odd down the line since the Disability Discrimination Act, and we still have these major issues in certain areas. So we can produce, obviously the report was so good and so detailed, you know, are we going to be producing it again in 15, 20 years with exactly the same information? Because I know obviously different groups again have produced different ideas on how to make these changes. And again, you know, maybe some of these changes could be driven by this, you know, by a disability group. That was certainly just an idea I thought I'd put out there and see what, you know, everyone could think, you know, see what everyone thought of, and then, you know, go from there. I just appreciate it. It may be a different way of thinking. I do believe that it would be better having the of Healthwatch, so yeah, that was my way of thinking, and I think also it'd probably be help keep some of the issues for the BOD report, keep them live, keep them hot, and help keep them going for the next report.
Okay, thank you, Paul. Does anybody from the board want to say anything on that?
Martha's got a hand up, Mike.
Can't see Martha. I'm sorry.
It was just a specific question for Paul, just following a sort of discussion I had on the radio this morning. I hadn't really thought about it, but it's about people who are blind and the fact that we're depending more and more on social media and Zoom communications. It's going to go on for a while. And that really is leaving them out. How do they cope in this, particularly in this new sort of internet heavy world? How do blind people manage? Is there some way of getting advocates for them? Do they, are you aware of that? And is that something that concerns you?
So I believe quite a few, obviously, again, it's all down to what support they have behind them and what tech they have, what computer systems they have, because some of them will have obviously talk to type and speech systems in place. But again, it all depends on, what technology you're aware of at the end of the day. So there's probably a lot of blind, partially blind, that may not know, what tech's available to them. So again, there's lots of disability, across the spectrum. There's probably a lot of people that are stuck in and don't have the ability to get out because of the technology side of things.
Okay, thank you. Anything else? I can't see any hands up. Okay, thank you for that. Then we move on to end of life, which is Alice, is it?
I like the end of life. Yeah. So just to say that, we've postponed this event discussing about end of life. However, with the business manager from Duchess of Kent sort of contacted us, and we had the conversation to bring forth a discussion about end of life. And she has invited us to their focus group to see how we can shape the event going forward. So I'll be meeting the focus group soon and then report back at the next board meeting.
Mike, the other thing I just quickly wanted to mention, because it's so absolutely current, the senior geriatrician today, Professor Oliver from Royal Berks, has said, with all the talk about do not attempt resuscitation stories that have been whizzing round, and there was a CQC report about it quite recently, he just did a very, very quick poll of how many patients under their care had respect forms or DNAR forms put in place, and he found it to be really low. So I think, again, one of the issues here is that we have potentially a new and slightly more enlightened process with the respect, which comes from the Resuscitation Council of Great Britain. And although universally it's meant to be being taken up, it doesn't appear to be. So it's obviously something, and with the DNAR stories that were circulating in the height of the pandemic, we should probably think about in putting this event together, because one of the key things he did say is we do need to talk about resuscitation. We do need to be talking about the respect form rather than just patients who are sat in front of him. It's something that everyone should be having this conversation somewhere with their families at some point, and the earlier of it, and also, again, a bit like with mental health and the stigma around it, it's clearly something that we have a challenge with in this country. So anything, be it an event, be it a focus group or something that can normalize things a little bit, will probably improve the dialogue and the conversation, and perhaps remove some of the fear. So yeah, I think we probably do need to do some work. Karen, you've got your hand up.
Things are slightly more difficult because of COVID, because whereas before it was fairly straightforward whether you wanted to be resuscitated or not, because generally if you are resuscitated, the outcome is not very good. That is not the same with COVID, that people, I think, are thinking that if they're in intensive care, there is, well, whereas it maybe some people might think that it may be it may be an end of life situation. I think a lot of people, it's been reported that actually people are surviving. So it does make things a bit difficult. And I've been talking to the resuscitation, so I'm on the forum about this. And I think that going forward, it's an issue that needs to be somehow pulled out and discussed.
Indeed. Okay, we will move on then, please, to item 10, which is Alice certainly leading on community engagement.
Due to COVID lockdown, we haven't had many community engagement. However, we're still recruiting volunteers, and we've had 3 new volunteers who, out of them, 2 of them have helped us with our reports, which has been really, really good. And yeah, I mean, I've been in contact with the others who have not, who've not been able to help, but they're keen to come back and do more work with us.
Ethnically diverse.
Also, just to share with you that Andrew was part of a community conversation on, when was it? On the 16th of February, 16th of March, whereby we had the community links turn around and sharing about, I think the theme was a lot about mental health, wasn't it, Andrew? Yeah. And so it was quite good conversation. So that's also ongoing, and we'll have more events like that.
And that was under the West Berkshire Diversity Forum banner, which is a joint initiative with Community United and ourselves. And I think what has been quite positive is I think there's been 3 or 4 events that have been incredibly well attended. And everyone who's sort of reported back on them seems to think they're very, very positive. So while COVID and the pandemic have made things very, very difficult, we have some huge positives. So one of the positives was that, as I think everyone on the board knows, we started to use the term EDC, ethnically diverse communities, because it was more inclusive rather than exclusive. And the Health and Wellbeing Board has now dropped the BAMER acronym. And in fact, there's a call nationwide to drop it as well, because it causes offence and is also quite a blunt instrument. So while we may end up using something slightly different from EDC, universally it seems to have gone down quite well as a rather clunky acronym, but the good thing is it includes rather than excludes, because some of the health challenges we've got, involve things like our Polish communities, our South American communities, and things like this that wouldn't necessarily fit into the previous obvious nomenclature of BAMER.
Yeah.
So I think Healthwatch has always got to keep its eye on health inequalities, health inequity where they're happening, not what the acronym of the group is. It's important that we go find where the gaps are, where the failures are, and highlight them, and rather than just being prescriptive. I think we've covered most of the other stuff off, Alice. So, social media wise, I think we're still sort of heading in a fairly positive direction.
Yeah, it's on the increase anyway.
And phlebotomy?
Phlebotomy is probably slightly erroneous in there, apart from I just wanted to report back that services do appear to be going more back to normal with the additional staff at the hospitals. And again, it's something we highlighted in the COVID report that, they need to think differently about how they do this, because we've got national television campaigns telling people to go to their GP if they've got issues or lumps and bumps and things like this. And one of the first things most GPs do is they send you for a blood test. And we currently have a bit of a postcode lottery that if your surgery does them on site, you'll probably get it quite quickly. But if you get sent to one of the other centres, your emergency blood test may still take a little bit longer, which just doesn't seem appropriate to us. So we'll kind of pick this up through the COVID report when it comes out in May. Judy, you've got a point?
West Berkshire Community Hospital are doing same day emergency
which is
blood
fabulous
tests.
to hear.
I've just had one. Very easy to book, just phone up and it's sorted.
Do you know if the online system is back up and running as yet?
I haven't checked the online system, but
Jane
I
seems to be nodding.
Yeah, I wouldn't have thought it was appropriate for an emergency appointment.
No.
Because I doubt they put anything online for that.
Yeah.
But I had a same day appointment and there were 8 phlebotomists operating. I've never seen so many operating at the hospital.
It's a lot.
Excellent.
I notice they do have rooms 1 to 8, but it's not often they're all filled, I wouldn't have thought, but that's excellent.
Jane?
I just say the service up there has been brilliant. Over the last few months, it's been absolutely brilliant.
Michelle, can we make sure we minute that? Because, as I said, one of the key jobs for us is not only to highlight where things don't work, but equally to highlight things where they do work. And, you know, I'm delighted that from Mike and myself raising this last August, I think it was, certainly BHFT, I think, have put in a bit of an effort. And obviously it sounds like it's succeeding, so well done.
And it is one of the items that planned care intend to make a focus of. So, okay, thank you. Right, we'll move on to item 11, which is the Joint Health and Wellbeing Strategy Group. Adrian, is this Adrian and you, Andrew, or?
Let me just quickly say, we were commissioned to do a couple of focus groups, and Alice, Michelle, and the team did a brilliant job. And if you look at the numbers from the focus groups, West Berkshire was the highest of all the health watches. We held more groups, we talked to more people. We can always do better, but well done, everyone. Adrian, over to you.
Andrew, just to say thank you to Martha, Leslie, and Adrian for supporting the focus group as well. So just to say that.
Yeah, just a quick update. As I said earlier, the strategy is being written at the moment. We managed to get some additional input into that process. So there was a panel meeting last night, rather grandly called the People's Panel, of I think about 11 people from Reading, Wokingham and West Berkshire. And they looked at the priorities on which the strategy is being based, which are health inequalities, vulnerable groups, early years, child mental health and adult mental health, although the actual wording may change a little bit. So it was a good discussion, wide range of input. The strategy is being written very quickly, and I'm not convinced that there's going to be enough analysis behind it to come up with something which actually does the job. But I think it will identify the sorts of things which they hope will be done in those areas, and then it'll be left to the providers and commissioners to actually deliver on that over the coming years. I think that's the way it's been planned. So the next draft is to be written by late April, to go to the health and wellbeing boards, a sign off, and then out to public consultation again. I don't know how long that will be for, but I would imagine a month or 2 months, with a view to having a final strategy sometime later in the year. So there is another chance to comment on it.
Okay, thank you. Martha, you've got a question?
You're on mute.
Oh, yeah, sorry. I was just going to say, we were talking earlier about our own, I think it was a thinking together, wasn't it? And how we must back about achievements and not be repeating the same things. We had 1001 days in the last strategy. We've got early years again in this one. Do we have any report back about achievements from the last strategy? I mean, this is over a long period. So, you know, I mean, I'm sure, you know, Adrian agrees that you've got to have some way of making sure that this isn't just a, you know, paper exercise, that things are actually changing.
Yeah, I mean, I think that point's been made in a number of the groups, I mean, including our discussion about it, which was fed back to them.
Yeah.
I mean, my concern is that they'll bring out this draft and we'll get lots of detailed comments like that and say, you know, okay, how are you monitoring? How are you going to monitor during the period of the strategy what's happening and adjust it and so on? And I think it's all going to be too rushed to actually take it into account. Is push, press hard.
Leslie.
Yes. Are there specific groups being set up in relation to each of the different priorities? Sort of either jointly across the piece or within West Berkshire?
That hasn't been mentioned explicitly in any of the meetings I've been in, but I think that's the idea, yes.
Yeah.
And I think we need to push to make sure that's not just professionals in those groups, but there are
absolutely, yeah,
public,
yeah, because in terms of sort of the more detailed action plans, you really can only do that with a smaller group where you've got, as you say, proper representation from everybody, from all the partners.
Yeah.
Andrew?
Yeah, I think my concern, as I've mentioned before, is that this doesn't just end up as a dusty document. And I wonder whether it needs to be discussed once it's done or once it's in some sort of draft final forum, both at things like health and well-being, but also the ICS executive. And actually, as Leslie sort of intimated, we actually start getting task and finish groups assigned or a senior responsible officer given the task of overseeing it. And then I think with what public health do need patting on the back for locally is they did their damnedest in a pandemic to make sure as many people could take part as was possible. We ended up with 4,000 people filling in the survey, which, while not superb, is still pretty good going based on what we were faced with. But one of the key challenges I took from that was I think it was the 18 to 25s filled in less surveys than the over 80s. And yet the survey is more likely to have an impact on their lives. So we, the system and all its partners, have a real issue with engagement of young people in terms of deciding things which will, you know, flavour their lives going forward, flavour their health outcomes. We haven't solved this, but I'm thinking this is partly why we're looking at things like the Thinking Together event, looking at younger people, and perhaps we need to almost look at it, remember this thread of lack of engagement. And we've got to do things better and differently to make sure they do engage.
Yeah, I agree. Okay, fine. We move on to the next item then, please. Item 12. This is the response or protected response to the white paper that we recently had thrust before us, Andrew.
Yeah, so there seems to have been some movement on this today. I haven't actually had time to fully look at this, but I'm led to believe the actual parliamentary bill is being talked about going through in May. I don't know if anyone else has picked this up, but there's obviously some thought that there's some speed we'll get along to this. And of course, the white paper in essence is probably the most significant change to the NHS in actually quite a long time. So probably more so than 2013. It covers the merger of NHS England and NHS Improvement. Various bodies can be changed. The marketisation seems to be disappearing. There's changes to regulation and regulators. So there's this creation of this new board of safety, this HSIB, which anyone doesn't seem to really entirely know what it's going to be doing. And of course, the key things for us, it's very vague on public engagement. It's very vague on governance. It's vague on supporting patient safety. and of course completely ducked social care, which was, I suppose, probably the most disappointing thing, because we keep talking about integration, and social care is such a key part with our population profile, and yet was largely missed. So they appear to be increasing powers both nationally for the minister and for the integrated care systems, which I think there are now 42 because some of them have merged. They're creating new bodies, new boards, the ICS NHS body and the Health and Care Partnership. And again, the relationship between the two boards is very vague in the white paper. It's a very complicated system, and the accountability does not seem to be obvious or flow through. So obviously these are things that I think, if we do put a response together, both jointly with our local Healthwatch partners and also individually, which I think we should do, we need to probably underline. They talk about engagement being focused at place, which would mean Berkshire West in our case, but they don't mention how it's meant to feed back in. Collaboration's meant to increase. And it seems to actually take steps back in terms of patient involvement. The regulation and patient safety will start to at least include private healthcare, which is good. But the people examining medical services may be compromised because of lack of independence. Social care is a real concern because obviously the sustainability of it. Where's our workforce going to come from for this aging population? That seems to have been missed out. Are we going to learn from things from the pandemic? And the patient voice just seems to be shrinking, which is a real concern. And is the integration agenda more actually about the organisations and their budgets than the actual care of patients? Is a huge concern that Healthwatch England has highlighted. And it's good that local Healthwatch is talked about throughout the actual white paper, but it's very vague. It's often optional. So we probably will have to see the actual bill to see whether or not any of these things get answered. The good thing is Healthwatch England are lobbying hard. Sir Robert Francis has given evidence to the select committee, and we do appear to have had Healthwatch put on a similar status to local authorities within the ICS. So all of that is kind of good, but I think there's more questions than sadly answers for something that's being seemingly rushed through. But if anyone's got any questions or comments, happy to hear.
No, okay.
Excellent. That can't happen very often.
Oh, Dawn.
Oh, sorry, Dawn.
Dawn.
I mean, I'm just going to throw this in there, but this whole social care thing, and it's this seeming veil of secrecy that they operate under, and you can never find out who to talk to, and nobody ever seems to say the same thing twice. And how can, and again, looking at it from the forum's point of view, how can we, for want of a better phrase, make them work with us? Because we have some serious concerns and issues over EHCPs and that lack of joined up thinking through social care. And like you say, it just seems across the board that they just don't seem to want to interact with anyone.
I think from our perspective, Dawn, and we have mentioned this, I think there's probably some joint work we can do, because you have all the evidence, all the testimony, and we potentially can put it under people's noses. So we probably should start doing that. Whether ultimately that changes anything is another matter, but at least if they have heard it and seen it, it's harder for them to ignore it.
Absolutely. And if they just talk to us and make us understand perhaps why they can't, would be, a starter for 10, if nothing more.
But I think equally getting responses from groups like yourselves to the white paper, although it's a bit of an exercise, it it's probably quite important, or certainly, so you should probably check with your national body to see if they've responded.
Yeah, where can we get hold of that white paper, Andrew?
It's certainly on the Department of Health and Social Care's website. It's probably on our website. I think Michelle would say it is.
Okay.
And the consultation
can
period,
raise that
I
at
think,
cluster anyway.
runs April the 16th. Am I right? Something like that.
Leslie, you had a hand up?
Yeah, I just wanted to say, as you all know, I've been working with Public Health England for the last 9 months around contact tracing, etc., and supporting outbreaks. And it was interesting to see that just last Wednesday, that Public Health England's sort of themselves had been informed that it was not going to be now called the National Health Protection Agency, which is what it was going to be called, and now it's going to be called the UK Health Security Agency, the health protection part of Public Health England. So this is the new kind of, but that's the way things are happening. Changes are being made, complete, sweeping changes, and then they just tell everybody, including Public Health England themselves, they're just informed at the last minute. Oh yes, well, now you'll be part of the UK Health Security Agency.
So James Bond's going to Public Health.
Apparently so, yes.
Dawn, Adrian's very kindly put the link to the white paper in the chat.
Okay, thank you, Andrew. STP ICS update, item 13. There's not a lot to say, I don't think, on that, is there?
Well, I don't think so. And again, bearing in mind we're in a pre-election period, I think probably reading the acronyms out is probably all we're allowed to do. I think the only thing we would probably say is it's still quite challenging. It is forming, and equally the white paper, when it becomes law, may change it again. It's good that we've got an excellent relationship with David Clayton-Smith, who I think is doing a splendid job as the independent chair. Our relationship with the senior management, I'm afraid, is tricky, but we are trying.
Okay, thank you. Item 14, the work plan.
Yeah, now we had hoped,
taken on board some
minor tweaks.
And do you want to send that around to people and we talk about it later rather than go through it now?
Yeah, I think effectively the tweaks make sense, but if we can send it round and agree it, the aim is hopefully to get it on the website this week. And then we'll just publish it as a board paper document. But I think one of the things you're quite right, and the rest of the board members have underlined we absolutely have to do, is make sure that we just start discussing this in October the coming year, and also we try and sharpen up when we finish things and how we decide we're finishing them, so that we can ensure the resources go in the right place. I think it's slightly complicated by when we do get commissioned work. Perhaps we need to account for that, or talk about it in the work plan in a slightly different way, because the commissioning of the work generally is to cover additional staff hours or something to enable us to do it, which is what's been happening with things like Thinking Together, and possibly maybe happening with some of the other projects we've talked about in the work plan. But we'll recirculate the tweaked version for the board. But can I just say a huge thanks to the board for all their work on it, because it is really important, and everything is a priority when it comes into the office or the virtual office via phone or email. So it's good to have that outside look at things. Thanks.
Thank you, Andrew. So if when that comes around, please have a look at it and everyone respond, hopefully positively, to Andrew. Right, our two hospital programs, the RBH and the Basic Stroke Hospital Improvement Program. What have we got to say on that, Andrew?
Well, Mike, I think you're probably as up to speed as anyone on certainly the Hampshire one.
Yes, the Hampshire one had run into a slight, well, I don't know about a problem, but it appeared that Amazon were about to build a very large base across the road from the proposed site of the new hospital, which various parties didn't seem to know a lot about. So I think they were going back to see how that affected the alleged site and all the various traffic problems and so on. And I haven't heard any more since then. Certainly the councillors of both Hampshire and the local councils are getting quite uptight about that. The RBH, we haven't had a meeting on that for a while. That seems to have gone strangely quiet. I don't know whether it will suddenly take off again. I was a bit concerned when the consultant seemed to disappear and someone else step in his place. I don't know why or what that happened, but it's gone a little quiet since then. And of course, the chief executive who had left it temporarily is now back. So I'm hoping that that might pick up speed.
Yeah, I think that's where we are with both of them. And equally, we're hearing that certain hospitals are being accelerated. So who knows? I think it's wait and see, and hopefully we'll be able to tell everyone what's going on with them. But certainly change is on its way, which hopefully will be positive.
Okay, well, thank you. We now come to any questions from the public stroke audience. So are there any questions?
I think it's Jane or Dawn, really.
And I don't see any hands. So fine, thank you very much. We'll move on to item 17 AOB, etc. So is there board members, are there any items of any other business? I don't, what's that hand doing in front of you, Alice? Was that? Oh, sorry.
Oh, it's your background changing. It looked like a hand.
Ah, right. Okay, fine. So that's nothing there. Okay, thank you. Right. So we now come to the date for the next meeting. Is Michelle still with us? Yes.
I'm still here. Yes, it's down for the 3rd of June, but as we discussed earlier, Mike, you're quite keen to move it further into June.
I'm not necessarily quite keen to move it. My comment simply was it's only 2 months and a couple.
But
of
Amanda can't make that date, so we may have to move it anyway.
I think also, if you bear in mind the lockdown in theory finishes on 21st.
3rd of June's a bank holiday anyway.
Yeah, it may be worth thinking about trying it slightly later, because we may actually be able to meet in the same room.
Yeah, so that might well be a good idea.
So Michelle, can we whiz round some dates for everyone after the 21st and see what people think?
I've got an informal board meeting on the down on the 24th of June. No, it's May.
There we go.
Here we go.
Yeah, so that will change as well. I always do it a week before the board meeting.
So that will change. So I can take that out then. Right, okay.
I'll update everything.
Did Karen say?
The June date, wasn't that bank holiday? Oh, I'm in the wrong month. It's May.
I'm sorry. Okay, right. Thank you. So we'll wait for something to go around to choose a date, A, slightly later, and B, hopefully in the post-lockdown period.
Great.
Okay, well, thank you very much indeed for today. Thank you to Dawn for coming along and giving a very interesting presentation, and keep safe, and see you hopefully for the next board meeting actually in person. Okay, thank you very much.
Thanks everyone.
Thank you. Bye.